Let's start out. Sandra, can you introduce yourself and tell us where you're from?
Yes, I'm an adult psychiatrist from the Netherlands, and I've been involved with ADHD in adulthood since 1995. So that's very long time. And I'm still curious and intrigued by what it all entails and what the comorbidities and the health issues and the female and the older people and all the kind of presentations that come with ADHD, because it's in such a way, it's a rich condition. That means that it's not only ADHD, it's almost always something else as well. And many people have several problems, and it's really a challenge to treat people with ADHD good and even better over time with more knowledge and research. So what I do is treating patients still every week and studying ADHD in adulthood and trying to innovate healthcare, educate professionals, and founding networks all over the world. The European network, the DIVA Foundation, the Power Bank, and the H3 network. So I'm a typical person that is networking.
I want to ask you about all of that, but if I'm not mistaken, you are a psychiatrist and researcher and activist for ADHD, correct?
Yes.
And a professor. Okay. Busy lady. How did you first get involved in studying ADHD?
When I was a resident, I detected my first girl of 21 who had a borderline personality disorder diagnosis. And I thought it is not borderline, but I don't know what it is. It's something else, but it looks like it, but it's not similar. It's not the same. I was intrigued and I thought something is wrong with this diagnosis, but I didn't know how and why. Then I heard by accident that ADHD was not outgrown in boys and that it persisted into adulthood, and that it was labeled then, because of a lack of a proper adult diagnosis at the time, as antisocial personality disorder in boys. I thought the antisocial personality disorder is the brother of borderline, which is usually in female patients. I made this connection and I thought maybe this is what's going on. I asked the presenter, can ADHD happen also in girls? At that time, there was nothing known, virtually nothing about adult ADHD in the Netherlands, nothing. He said, yes, it's possible, and you just investigate the criteria, and then if you need any help, you can ask me. Was a child psychiatrist. So I did. When I asked the criteria from this girl and her parents and her sister, they all cried because they felt so recognized. It struck me. I felt this is something important. This is not a normal diagnosis for them. It's really different. And for me, it was also very new. I decided to look further into it. And that was the beginning of the whole story.
Wow, that emotional early moment really shaped your whole career, which has been an amazing career. You're right now at the forefront, it seems, of the research about how women's hormones affect their ADHD.
Mhm.
Say a little bit about that.
Yeah, it took me a few decades to get there, which I regret now because it's a bit late to find out about women. But nevertheless, I thought I first need to take care of the whole concept of adult ADHD, that everybody understands it's existing, that we have validated it, that we have studied the population percentages, that we have treated them with Ritalin, and that we can differentiate it from comorbidities. Then we have the older people after 65, and then again, nobody has ever heard about ADHD, and it all starts over again. I cannot let it happen, so I've a study on older people with ADHD to ensure that they would get help after I'm retired, so that there is evidence that there is a continuous line of persisting symptoms over time. Now I finally arrived at the female ADHD presentation. My patients asked me, begged me for years to study their hormonal mood fluctuations. Every premenstrual week and postpartum and also perimenopausal, there are severe complaints of mood, but also increased ADHD severity. We developed a questionnaire in 2016, and I gave this questionnaire to 200 women at a female ADHD conference. Nobody was allowed to leave without filling in the questionnaire. And I had people guarding at every door so that it really happened, because otherwise the data would not be reliable. I needed to be able to say, of all 200 women visiting this conference, X percentage had this and that symptoms of the premenstrual, postnatal, and perimenopausal mood disorders. This was quite shocking because it was highly increased. It was 2 to 3-fold increased compared to the prevalence in the general population in
Wait,
women.
so you're saying that women with ADHD have worse hormonal fluctuations or mood fluctuations?
I'm not aware of their hormones, but of their mood fluctuations I am. These
Okay.
mood fluctuations are related to the phases that we know that the estrogen drops. So
Okay.
that's premenstrual, postnatal, and perimenopausal. Estrogen is the big important hormone, the female hormone, that's involved in cognition and mood as well. Once you understand that female hormones are not only acting on female organs or sexual attraction or sex drive, you understand it's also a cognition hormone or neurotransmitter and a mood hormone, then you start to understand the interaction in women with ADHD who have lack of dopamine. Dopamine has similar actions as estrogen in the brain.
When
So
the
working on
estrogen drops,
cognition and mood stability.
yeah, when the estrogen drops, the dopamine drops as well then? Or-
Estrogen and dopamine are closely intertwined in their production. They stimulate each other. So if estrogen drops, I suppose dopamine is also less able to cope, to level up. So yes, I think dopamine drops too. But on the other hand, estrogen has similar functions as dopamine. So it's twofold.
Women with ADHD have worse cognitive and emotional reactions during times when their estrogen might be low, such as before their periods, after birth, and in menopause. Is that correct?
We repeated the same questionnaire in our department again among 200 women, but now we were sure they had a proper diagnosis. And we published that one in 2021, and we found similar results. So 2 to 3-fold increased prevalence of severe mood symptoms in all 3 episodes. And Attitude did a similar investigation last year and found similar numbers. Also, postpartum depression, for instance, is 60%.
Wow. Huh.
That's amazing. That's so high. In the population, it's not higher than 19 at max. 19.
60% of
Women with
postpartum
ADHD have
depression.
had at least one postpartum depression. They
Wow.
reported.
Wow.
And perimenopausal is the worst because it takes 10 years.
That's really our focus with the coalition is on girls and diagnosing girls early. So, what might this research have in relevance to them?
Yeah, we still don't know much about young girls, unfortunately, but we do know that ADHD is underdiagnosed in girls and that it starts being recognized after their period starts. So after menarche, this is again proof of the concept that estrogen up and down starts to give more severe ADHD symptoms and mood symptoms and destabilizing these girls that might have been able to cope more or less before menarche. We also have the impression that there might be a change in menarche age. Being earlier or later, we don't know yet, but we assume that perimenopause starts earlier in ADHD.
Interesting.
That's coming from one genetic study showing that the genes of ADHD are connected to this phenotype of early menopause. That means before age 40. Those women already have premenstrual depression,
Ah,
and then this premenstrual depression starts creeping backwards until it's not only in the last week, but also the 3rd week and the 2nd week until it's the whole month. They don't know why that is. They are not aware of this early menopause because nobody expects it. The GP not, the women not. And we're now doing this big survey, women's health survey, that's online. I can send you the link afterwards if you want, because English-speaking women can still participate. In this questionnaire, we will ask about age of menarche, age of perimenopause, final menopause, so that we have thousands of women and their data on these life events that are so important in females' lives.
moving back to younger girls,
Yeah.
are you saying that ADHD is often diagnosed in girls just at the time they first have their periods, and that maybe that's because of worsened symptoms?
Yes.
But by that time, girls might have already have spent some years coping. I'm wondering, we're all about early diagnosis. So I'm wondering if how much that might influence perhaps reducing the comorbidities that girls have.
Could be because if you treat ADHD on time, girls will suffer less. They don't need to develop as insecure girls that are always having low self-esteem and doubting their capacities and feeling dumb and lazy and stupid and everything. It's very important for the development of girls that they are early diagnosed and also get help, support, or and treatment if necessary, so that it's nothing abnormal for them to understand that what ADHD is and that you can live with it in a better way. I'm absolutely for an early diagnosis because all women that I meet say, if I had known earlier, I could have made different choices. I could have finished that school or that education or kept that partner that left me because of my PMDD, everything. It's really worrisome, this late diagnosis. And there are many other reasons, by the way, that women may get a later diagnosis. For instance, the criteria for ADHD are based on boys and men in research, and nobody has looked after their hormonal mood changes. Nobody has considered that if you have premenstrual increase of symptoms, you may have the diagnosis easier in the last week of the cycle as compared to the first 3 weeks of the cycle, in which your estrogen is still helping you to cope more or less. This is something we want to implement in the new DIVA, the diagnostic interview we made. That's a worldwide instrument in now 31 languages. We never realized that we should take this into account when making an assessment. That you need to know what day of the cycle this woman is in when we endorse the symptoms. In order to develop female-specific, phase-specific norms for diagnosis. That's what we're aiming for.
Do you feel that the scientific community is accepting these new findings? Are you hopeful that they will be integrated into common clinical practice?
Nobody can deny it over time when the data will show that there are differences, but we still have to show that. We're now preparing to adjust the DIVA-5 based on the input of women with ADHD, of professionals who are experienced in women with ADHD from all over the world, using focus and Delphi methods to get their input and to check whether or not we should change certain examples of the criteria. We cannot change the criteria themselves, to be sure. This is not our job, it's APA. It's their decision which criteria are used and based on research in men, but we can make a start showing female-specific examples. We can study them, whether it helps women to get earlier diagnosis, for instance.
This also matters because these possible hormonal influences are affecting women's heart, right?
Yeah.
Can you talk a
Yeah.
little bit about that?
Oh yeah, this is maybe most worrisome problem. I found a head heart hormones network in the Netherlands, H3 network. You can find it in Dutch, a little bit translated online.
Great.
This is a network of gynecologists and a cardiologist and me, psychiatrist. We found each other because this cardiologist said, I have so many women with ADHD in my clinic and maybe 25%. I said, that's a lot. If that's true, you must screen. Here's my screener. Please screen several hundred women in your clinic, one after the other, in a certain period. She found 35% had lifetime ADHD symptoms, not diagnosis, but symptoms. But this screener is pretty good, in my experience, a short one, but it asks for lifetime symptoms. She referred 20 women to me with severe menopausal, cardiovascular, and ADHD symptoms and mood issues, of course. We tried to cooperate to treat their heart, but also their mind and their hormones and their sleep in order to give rest to this heart that was all the time being, well,
That's
because
stress.
it
Yeah.
is stress, lifetime stress on the heart.
Yeah.
You can never relax, you cannot sleep. You only always go on, and you never give up because you're a woman with ADHD, a tough cookie. But it is, in the end, very detrimental to your physical heart health. This prevalence of 35% is tenfold increased compared to the population
That's so interesting.
because
Yeah.
all those women were perimenopausal.
Oh, yeah. Whoa. Uh-huh.
Where the women with ADHD were 2 years younger.
Uh,
This have to do with their earlier menopause. So an earlier drop in estrogen might induce earlier cardiovascular disease. Estrogen protects the heart. It's good to have estrogen and not to get rid of it too young, because it protects your bone density, it protects your cognition, your mood, and your heart health.
Are you seeing that men with ADHD also have higher heart issues?
All people with ADHD have increased risk for cardiovascular disease,
Uh-huh.
but it was not known that women in perimenopause were getting the disease earlier and were overrepresented in a cardiology clinic. That's
Yeah.
new. That's what we published in 2023. It's only a first pilot study, but Swedish registry studies have shown and proven that cardiovascular disease is 38% in adults with ADHD compared to 23% in the general population.
So what's next? Are you working on any papers that are coming out soon?
Yeah, we're working on a short report for European psychiatry on how to measure hormonal mood changes in women during assessment and treatment, and how to follow up and how to treat it, giving examples of questionnaires that clinicians may use to find out with these practical tools. The other paper is a position paper by 40 researchers around the globe about where are we with research and which are the research gaps in female ADHD. It goes from the onset of puberty, which I mentioned, to the early age of perimenopause, to PCOS and endometriosis, which seem all increased in ADHD as well.
What is PCOS?
Polycystic ovarian syndrome.
Okay. Okay.
Yeah, that's a reason for infertility and for obesity, and it's associated with ADHD. We don't know why. We have no clue. It might be hormonal, genetic, and interactions, maybe inflammation. We have to find out. These are all questions that are in this women's health questionnaire that's still available for English-speaking women.
When you look at the research gaps, what would you most like to see studied?
I'm dreaming of a large study comparing what's the best treatment for whom. Who could benefit from hormone treatment, from the pill in young girls, which pill or the coil, or which is best for mood in ADHD. Also compare with SSRIs for depression that are proven effective for premenstrual depression, for instance. We don't know whether postpartum depression may profit from hormonal therapy, never done, but it could be, because
Okay.
the
Yeah.
luxation of mood disorder is by the drop of estrogen. At least it's at the same time. And it's only logical to give it a try. Maybe it could resolve depression very quickly, but it's never been done. You need a lot of women. You need a lot of time and money to get it done. Maybe we should start with smaller studies to give a hint of directions for future studies. That's maybe how it should start.
Is there any research indicating that it helps to increase your medication for ADHD?
Good question. I forgot almost my own study. We did a small pilot study in women with ADHD and premenstrual depression. If estrogen and dopamine help each other, we could increase estrogen in the premenstrual week, for instance, using the pill continuously, but also increase dopamine in the premenstrual week. That is what we do by increasing the stimulant dosage a little bit in the last week of the cycle in women with both ADHD and PMDD. This helped all 9 women. It was not placebo controlled. It was not a big number of people. It was just 9 women. It was female specific increase of stimulant doses in the premenstrual week. It's highly cited already, and women feel so much recognized and validated that these are real complaints and that they really deserve a biological treatment for that.
That's so fascinating. I had a casual conversation the other day with somebody. She's younger. I always talk to her about her ADHD. And when she said, I realized it was ADHD and not depression, I was so happy. It's funny. It's maybe less stigma about it, but
The biology stands out so much that it's not your fault. Depression is not your fault either. It's also highly biological in many cases. There's always interaction with environment and situations, of course, but it's nobody's fault. Psychiatry is nobody's fault. No.
yeah. This has been wonderful. Is it too late to take hormones?
If you are above 60 and you have never tried it before, it is too
Not a-
late. The organs get insensitive to hormones 10 years after menopause. Let's say if your menopause was at age 51, which is the mean age, and you're now above 60, it's 10 years later, and then it's too late. But if you start earlier, you may continue longer
Right.
because your organs stay receptive as long as you use it.
I wish I'd known.
Yeah, I can imagine.
We're so honored with all the work you've done. I wish more people knew about it. In the US, it doesn't seem that it's talked about very much.
Well, Scientific American just did a big story about this research, which was very cool. And it was a big theme at the APS conference. It is starting to get attention in the US.
Yes, it's starting, definitely. There's no way back. After you know it, you cannot go back in history.
Thank you so much for doing this work. It's just been really so interesting to talk with you.
Thank you. I love to do it. Thank you. Thank you, Cynthia, for the invitation, and Catherine for the nice interview.
Take care. Keep it up.
Bye. Bye.
We believe all girls with ADHD should get a fair start in life by getting diagnosed by age 8. Visit us at www.findtheadhdgirls.org. Thank you.